Hi, I'm Ashley, and I'm going to do my presentation on sexually transmitted diseases. So, what are STDs? So, STDs, they're infections that are transmitted during vaginal, anal, and oral sex. It can be caused by bacteria, viruses, or like parasites, and usually they're passed on from one person to another. There are a lot of forms of STDs out there in the world. And although we're familiar with a huge variety, we also don't have a lot of information on them. STDs can be life endangering, and others have cures to them. There are a lot of factors in prevention, and there's also a lot of research on them and how they affect people on a day to day basis. So some common examples of STDs are the genital herpes, there's chlamydia, gonorrhea, HIV, AIDS, syphilis, and hepatitis. So today I'm going to talk about a few of them. So how are STDs different from one another? So some STDs are curable, some of them are permanent, like you can cure them, but you'll still be a carrier of that disease. And almost all the STDs show side effects, so they're pretty distinguishable as to which one is which. So the first example I have is for chlamydia. So chlamydia, women feel pain during intercourse. They also have lower abdominal pain, and they also have a change in bleeding pattern when they're on their period. And for men, there's discharge in their general areas, and they can also have lower abdominal pain. For the cure for chlamydia is just medication, so it's not that big of a deal because you can cure it. And some other side effects that are not physical pain is like eye discharge or spotting. And yeah, I guess there is pain during urination as well. But yeah, that's chlamydia. So here I have a women and men comparison so you can see what chlamydia looks like and where it's located for women and where it's located for men. So next I have genital warts. So genital warts, they have side effects in men and women. They have the same side effects. So there's going to be lumps around the genital area. Sometimes they can develop in the mouth area, and they're pretty distinguishable. They're small brown or pink like swellings in your genital area or your mouth, and they're like bumps, and then they itch a lot. So to cure this, you can either take medication or you can surgically remove them. So you hear on the picture, there's example of where they're usually typically found. So for men, it's on the shaft, and for women, it's on the vagina or around like the anus as well. Another example is gonorrhea. So women have painful urination, they have more vaginal discharge, they're also bleeding a lot more, and they also have abdominal pain. And for men, they have painful urination as well. They have like a pus or discharge from the tip of their penis, and they also have testicle pain or swelling. So the treatment for this would be antibiotics or medication. So it can be cured. And the symptoms for gonorrhea that are not like physical pain would be fever. Women have irregular menstruation, and you usually have a sore throat. And here is like a visual demonstration of gonorrhea. So for the female and then the male, and how I said that there's pain in the lower abdomen, and then there's bleeding between periods, and then spotting after intercourse for female. And then for male, it's the greenish or yellow discharge in the penis area. There's the redness and the itchiness in the eyes, and then, like I said, the swollen glands in your throat. So another example would be hepatitis B, or it's also known as HBV or HEPB. So again, both men and women feel the same side effects. So there's the abdominal pain, the dark urine, and the yellowing of skin and eyes. So for this hepatitis, so there is no cure, but you can get rid of it temporarily. And once you get rid of it, you'll still be a carrier of the disease. So it's not something that can go away forever. And then you also feel fatigue, loss of appetite, and nausea. So hepatitis B is different than the other forms of STDs because there's different forms of catching it. So you can catch it by obviously having sex, or you can have like household contact. And by that is like sharing razors, toothbrushes, earrings, things like that go inside of your body. And then unsterile healthcare practices, and then sharing needles is a big one too. Or you can also get it from tattoos, piercings, barbers, or things like that. And then there's also when you give birth to a child. So a mother who is a carrier of hepatitis B can actually give it to their child during birth. And then there's the direct blood to blood contact as well. So why should you care about STDs? So teenagers are affected the most because I feel like teenagers are not educated on them as much as they used to. There's also the long-term health issues. Like I said, you can be a carrier even though you don't have it, and it can be transmitted to other people, which is a big thing because not only you have it yourself, but you're giving it to other people as well. So when should you get tested? So for the ones that I talked about for gonorrhea, you should get tested about 2 to 30 days after exposure. And then for chlamydia, you should do 1 to 3 weeks after exposure. For hepatitis B, 3 weeks to 2 months after exposure. And then obviously there's all these other ones as well as to when you should get tested if you feel like you think you have it. So what is the main way that you can prevent STDs? So obviously it's protection when you're having intercourse, but other ways is you can get tested yourself anytime that you feel uncomfortable. You can also ask to get your partner tested before you decide to do something together. And like I had mentioned with the disease is that you can keep your bodily fluids to yourself, as in no blood to blood contacts, don't share the needles, don't do any of that. That can go from one body to another. So you should definitely practice safer sex. So like I had mentioned, you should talk to your partners and see what's the best option for you guys to get tested. Another thing that can be a big deal when transferring and having STDs is doing drugs and alcohol. A lot of people can take advantage of others when they're under the influence. People should be educating themselves as to what can happen once they have an STD. So the main thing is to just be safe, take care of yourself. It's not just yourself that you're putting at risk, you're putting others at risk as well. And yeah, those are my sources. Okay, thank you.